Hello everyone, welcome back to my channel. Today, we'll do a rapid review of 100 key endocrine system conditions and definitions. This video is designed for quick revision and memorization of high-yield terms for pharmacy school. Pituitary gland disorders, gigantism, excess growth hormone in childhood, acromegaly, excess growth hormone in adulthood, pituitary dwarfism, growth hormone deficiency in childhood, hypopituitarism, decreased pituitary hormone secretion, hyperpituitarism, excess pituitary hormone secretion. Pituitary gland disorders, prolactinoma, pituitary tumor producing prolactin, diabetes insipidus, ADH deficiency causing excessive urination, SIADH, excess ADH causing water retention. Pituitary adenoma, benign pituitary tumor, empty sella syndrome, flattened or damaged pituitary gland. Thyroid gland disorders, hyperthyroidism, excess thyroid hormone, hypothyroidism, deficient thyroid hormone, Graves' disease, autoimmune hyperthyroidism, Hashimoto's thyroiditis, autoimmune hypothyroidism, goiter, enlarged thyroid gland. Thyroid gland disorders, thyroid nodules, abnormal growths in thyroid, thyroid cancer, malignant thyroid tumor, subacute thyroiditis, painful thyroid inflammation, congenital hypothyroidism, thyroid hormone deficiency at birth, iodine deficiency disorder, low iodine affecting thyroid. Parathyroid disorders, hyperparathyroidism, excess parathyroid hormone, hypoparathyroidism, deficient parathyroid hormone, secondary hyperparathyroidism, compensatory hormone excess, parathyroid adenoma, benign parathyroid tumor, hypocalcemia, low calcium due to hormone imbalance. Pancreatic, insulin, disorders, type 1 diabetes mellitus, autoimmune insulin deficiency, type 2 diabetes mellitus, insulin resistance, gestational diabetes, diabetes during pregnancy, prediabetes, elevated blood sugar, not diabetes, hypoglycemia, low blood glucose. Pancreatic, insulin, disorders, hyperglycemia, high blood glucose, insulinoma, insulin secreting tumor, diabetic ketoacidosis, severe insulin deficiency, hyperinsulinemia, excess insulin levels, glucagonoma, glucagon secreting tumor. Adrenal gland disorders, Cushing's syndrome, excess cortisol, Addison's disease, adrenal hormone deficiency, congenital adrenal hyperplasia, genetic adrenal enzyme defect, pheochromocytoma, adrenal tumor producing adrenaline, hyperaldosteronism, excess aldosterone. Adrenal gland disorders, hypoaldosteronism, aldosterone deficiency, adrenal adenoma, benign adrenal tumor, adrenal carcinoma, malignant adrenal tumor, adrenal insufficiency, inadequate adrenal hormones, stress hormone imbalance, abnormal cortisol regulation. Reproductive hormone disorders, polycystic ovary syndrome, PCOS, hormonal disorder in females, hypogonadism, low sex hormone production, hypergonadism, excess sex hormone production, precocious puberty, early onset puberty, delayed puberty, late sexual development. Reproductive hormone disorders, menopause, end of ovarian hormone production, androgen insensitivity syndrome, insensitivity to male hormones, estrogen deficiency, low estrogen levels, testosterone deficiency, low testosterone levels, infertility, hormonal, reproductive hormone imbalance. Pineal gland disorders, melatonin deficiency, sleep regulation disorder, circadian rhythm disorder, disrupted sleep-wake cycle, seasonal affective disorder, SAD, light-related melatonin imbalance, pineal tumor, growth affecting melatonin, delayed sleep phase disorder, late sleep pattern. Thymus disorders, thymic hyperplasia, enlarged thymus, thymoma, tumor of thymus gland, thymic aplasia, absent thymus, immune endocrine disorder, hormonal immune dysfunction, myasthenia gravis, thymus-related, autoimmune neuromuscular disease. General endocrine disorders, hormonal imbalance, abnormal hormone levels, endocrine hypertension, hormone-related high blood pressure, endocrine obesity, weight gain due to hormones, metabolic syndrome, cluster of endocrine risk factors, growth hormone deficiency, low GH levels. Genetic and rare endocrine disorders, multiple endocrine neoplasia, men, multiple gland tumors, Kallmann syndrome, delayed puberty and smell loss. Turner syndrome, chromosomal hormone disorder. Klinefelter syndrome, male chromosomal hormone disorder. Prader-Willi syndrome, appetite and hormone disorder. Calcium and bone hormone disorders. Osteoporosis, hormonal, bone loss due to hormone imbalance. Rickets, vitamin D deficiency in children. Osteomalacia, soft bones in adults. Vitamin D deficiency, impaired calcium absorption. Hypervitaminosis D, excess vitamin D. Stress and metabolic hormone disorders. Chronic stress disorder, long-term cortisol imbalance. Insulin resistance syndrome, poor insulin response. Leptin resistance, appetite regulation failure. Ghrelin imbalance, hunger hormone disorder. Thyroid hormone resistance, reduced hormone sensitivity. Other conditions, endocrine tumors, hormone-producing tumors. Autoimmune endocrine disease, immune attack on glands. Iatrogenic endocrine disorder, caused by medical treatment. Congenital endocrine disorder, present at birth. Acquired endocrine disorder, develops after birth. Other conditions, endocrine fatigue syndrome, chronic hormone exhaustion. Subclinical hypothyroidism, mild thyroid deficiency. Subclinical hyperthyroidism, mild thyroid excess. Pediatric endocrine disorder, hormonal disorder in children. Geriatric endocrine disorder, hormonal disorder in aging. Mixed, systemic conditions, diabetic neuropathy, nerve damage from diabetes. Diabetic nephropathy, kidney damage from diabetes. Diabetic retinopathy, eye damage from diabetes. Endocrine crisis, acute hormone imbalance. Hormone-secreting cancer, cancer-producing hormones.